Localizing cortical lesions. The right cerebral hemisphere is usually the non-dominant hemisphere, and the left is usually the dominant hemisphere. The non-dominant frontal lobe presents with disinhibition, memory disturbance, incontinence, which is at the paracentral lobule level, supplied by the anterior cerebral artery, and anosmia if the lesion compresses the first cranial nerve, which is right underneath it. The dominant frontal lobe has the same presenting signs and symptoms, but it also has motor aphasia, also called Broca's aphasia, in which the person's verbal output would be markedly reduced. Right or the non-dominant parietal lobe lesions present with hemi-neglect, in which he doesn't know that half of his body exists. Spatial disorientation, constructional apraxia, dressing apraxia, homonymous hemianopia. While the dominant parietal lobe lesions or the left parietal lobe lesions present with dyscalculia, dyslexia or inability to read, apraxia, which is he cannot perform skilled movements, agnosia, which means he cannot identify objects, and homonymous hemianopia. Right or non-dominant temporal lobe lesions present with poor non-verbal memory, loss of musical skills, and homonymous hemianopia, while the dominant or the left temporal lobe lesions present with sensory aphasia or Wernicke's aphasia, which is the inability to comprehend language, both written and spoken. But their word output is increased, but they often make no sense at all. Dyslexia, which is the inability to read, poor memory, complex hallucinations, and homonymous hemianopia. Occipital lobe lesions present with visual agnosia, visual hallucinations, color agnosia, which is the inability to recognize colors, hemianopic scotomas, homonymous hemianopia if the lesion is on one side, and if the lesion is on both sides, the patient would have cortical blindness. Balance syndrome, which is simultagnosia. He's unable to identify two objects simultaneously. Optic ataxia, which is he cannot reach for an object visually. Oculomotor apraxia, and Anton syndrome, which is he denies that he has cortical blindness. General findings in cortical lesions are seizures, altered sensorium, hemiparesis, hemianesthesia, and homonymous hemianopia. Hemiparesis would occur if the motor cortex is involved. Hemianesthesia would occur if the parietal sensory cortex is involved.